Call meeting to order. Roll call. Here.
Maggie is excused. Rosemary? Here. And here. Max.
Okay, Rosemary, the mission statement.
Our mission is to anticipate and provide services to meet the health care needs of the people we serve.
Thank you very much. President, welcome everyone. We want to start off by acknowledging that the district acknowledges that SEIU will be representing our employees. When Dr. Heron gets here, we're going to give him, he's celebrating 20 years of service with us. So when he gets here, we'll stop our meeting and then do that so we can get back to work. Okay? Approval of the minutes of the last meeting. Any questions or additions?
I move the minutes be approved as mailed.
Okay. Do I have a second?
I'll second.
Okay. Roll call vote.
Graig?
Yes.
Rosemary?
Yes.
And? Yes. And Max?
Okay. I'd like to take a moment to recognize the remarkable milestone of our district history. Dr. Jaime Heron has reached 20 years of dedicated service with us, and that's something truly to be celebrated. For 2 decades, Dr. Heron has been at the heart of our medical team, providing compassionate care and earning the trust of countless families in our community. His commitment to his patients and his profession is evident in everything he does. Dr. Heron, you have truly set a high standard for medical excellence, but have also been a key figure in shaping the quality of care that we offer here. On behalf of the entire board, I want to extend our deepest gratitude to you, Dr. Heron, for your years of service and your ongoing dedication to our community's health and well-being. We look forward to many more years of your valuable contributions. And on a personal note, you're my doctor, and I appreciate that very much. Okay, my friend, thank you so much.
I'd like to introduce myself. My name is Ken Fleming, and I'm running for director here, so more to come.
Thank you.
My name is Eunice. I'm a CNA for the morning shift, and I also pick up shifts PM and NOC whenever it's needed. We're pleased that the Soledad Community Healthcare District Board follow labor law and recognize our union status. Thank you. We are ready to bargain our first contract. We believe that this union recognition is the start of a long, fruitful partnership between Soledad management and us, the workers. We're ready to sit down and hear management out as we finally have our issues addressed. Skyrocketing turnovers leads to dangerous understaffing and in turn leads to even higher turnover rates, unsafe for both the staff and the residents. Now that management seems ready to bargain, there is hope that this can really change for better in terms of addressing our facilities concerns. For so many of us, residents are like extended family members. We aim to address our facilities understaffing crisis so that we, the workers, have the time, capacity to give every resident the quality care they deserve. We love the work that we do, and we just want a safe, secure work environment to help take care of the people under our care. We know that our facility can be much better than it currently is, and we are willing to work with management to achieve that goal. We're anxious to get to work in addressing the issues and getting on the path to a strong contract. Lastly, for the sake of our facility as a whole, we are excited to work with the district to secure additional funding. We look forward to having a long, prosperous working relationship with management and being members of the Local 2015. Thank you.
Hi everyone, my name is Eric Mora and I'm here on behalf of Monterey County Supervisor Wendy Rudasty to express her support for Soledad Healthcare District workers. Thank you so much for recognizing your workers' decision to join SEIU Local 2015. Workers are ready to negotiate their first contract, and once negotiations in good faith begin, the real work of improving the Soledad Healthcare District can begin. Again, thank you for taking that crucial first step. A union is a net positive for everyone involved in the Soledad Healthcare District. Thank you so much.
Hi, good afternoon. Thank you for the time. My name is Victor Caraves. I'm the political organizer for Monterey Bay Central Council, former SAU 521 member, and 14 years of employee as a county employee managing in-home support services and the home care programs. And this is a vital program. This is a crisis. These are the people that represent and also provide the services and the work every day in, every day out. And I think this is a time that we can consider, move forward with an action for everybody in this community. Thank you so much for your time. Thank you for your do. I know sometimes it's meetings in, meetings out, but you got great examples. You got stories. You name it. We represent nurses, social workers, psychologists, teachers throughout the Monterey County and Santa Cruz County. So there's a crisis everywhere. So I think I'm here to advocate for these great workers. Thank you for your time, and hopefully you guys take an action on these items.
Thank you.
Hi, good afternoon, everybody. My name is Rosa Gamboa, and I'm an SEIU Local 2015 employee. I'm a union rep. Workers at Soledad Healthcare District, like so many other nursing homes employees, have been dealing with waves of turnover that have given way to a massive understaffing crisis. Workers are burning out from juggling too much. There are only so many residents a single worker can look after at a single time. That is why they decided to join the union, SEIU Local 2015. Management needs to stop prioritizing their agendas and with delays, and instead address the very real issues that Soledad Healthcare District workers face on a daily basis. Now that workers have been acknowledged and certified as union members, the real work can begin in making Soledad Healthcare District all that it can be. Every Soledad Healthcare District worker has a right to a safe and secure workplace. If they are taking care of folks on a daily basis, there's no reason why their own safety shouldn't be guaranteed by safe staffing protocols and the backing of a labor union. In order for management to have a productive and mutually beneficial relationship with their workers, they must respect workers' right to union. Here's what management is failing to realize. Workers having a union is a net positive for everyone involved in Soledad Healthcare District. Soledad Healthcare District workers need and deserve a union. That is only viable path forward if Soledad Healthcare District is ever going to be able to fix its workplace issues. Thank you.
Hello, my name is Sherry Abella. I'm a research analyst with SEIU Local 2015. I want to thank the board and recognize that you have recognized the union and that we can move forward with the next steps. SEIU Local 2015 looks forward to working in partnership with the Soledad Community Healthcare District. The local will use our resources to maximize state and federal funding for a fair contract that will lower staff turnover, which will raise the quality of care benefiting the patients, the residents, and the workers of Soledad Community Healthcare District. Thank you.
Anyone else? Okay, we'll close the public comment. Thank you very much for your input.
Good afternoon, everybody. Thank you for being here. I am the communications coordinator, and I would like to present my report of the month of August. And as you can see on the cover page, we have a brand new therapy team that we are so excited to have because our residents are receiving the care that they need. And we had a mixer to celebrate that, and also to invite healthcare professionals who ultimately will refer their patients here to us. That was held on August 22nd. Thank you to Anne, Rosemary for attending. I know, Greg, you sent your apologies for not being able to make it, so thank you for that. It's always nice to have board members who care. Thank you, we appreciate that. I'm sharing the press release that I wrote out. We were able to get on the Salinas Tribune advertising the event, and as you can see, the guys were able to have a photo shoot. So I also took individual photos of them that way they can use for their own purposes as they wish. Going forward, we are excited to be sharing that our very own CEO got nominated to be CEO of the Year by the Association of California Healthcare Districts. So we are celebrating because this is a statewide recognition. This nomination not only speaks to Ida, but it speaks to the great work that we are all doing here at Soledad Community Healthcare District. So I would just like to take a moment to appreciate Ida and these flowers from the staff. So our staff got together and bought flowers for Ida. And Ida was able to speak on the radio based on the press release that I sent out. And we're hoping that other media outlets will pick it up as well. Going forward, we are finally going to officially reopen our soda shop. And we expect to see you all of you, on September 5th from 12:30 to 1:30 to make sure that you can enjoy ice cream, popcorn, and hot dogs all for 50 cents. And we are also having a 50 cups for the 51st guests who come. They'll get a free cup. And then later you'll see that I have 2 pages of collages of the activities that we've been having at the district. You will see Monique and Dr. Hidon being recognized for their anniversary. Monique turned 1 year and Dr. Hidon turned 20 years here with us. We also have the Lions Club, who was gracious enough to come and barbecue for our residents and staff. So they were able to do that for us. And we have a couple birthdays. Ida and I helped out the Rotarians in serving over, I think it was over 300 teachers from the Soledad Unified District. So we were lucky enough to do that. We also visited the Historical Society with their new exhibit about women's dresses. So we were lucky enough to do that. And the bottom picture, you will see that our leadership team, some of our leaders and managers were able to get recognized for successfully completing their leadership academy. And this is a 8-month program that aims to provide managers and upcoming leaders with professional development. Next, you will see that we had our summer employee barbecue. Thank you, Mr. Stephens, for barbecuing for us. And finally, we took an all-staff picture to celebrate that we filmed our first commercial that embodies the synergy of care that we have here at Soledad Community Healthcare District, by emphasizing that it is not just the clinic, it is not just Eden Valley, it is all of us who provide the care that we need for our community. Is there any questions?
Very good report. Any questions? Yes.
2 things. I just want to make a comment that the open house that you had for the physical therapy department was very nice. That was really a nice presentation. It was nice to meet them, and good representation of the district. On this nomination that Ida got for hospital care district, she's nominated, but when did we find out?
The award ceremony is on September 26th.
Oh, okay. September what?
26th.
At the ACHD meetings.
Oh, the conference.
We should go.
Where is it?
Sacramento, I think.
Any other questions?
But
Are you going, Ida?
Yeah, I also want to congratulate Ida. This is all of California we're talking about. And so we're so lucky to have her, and I want to congratulate her.
Absolutely.
That's really nice. Good luck.
That concludes my report. Thank you.
Thank you very much. Okay, treasury report. Grant?
Okay, give you an update
We're still working on closing the month of June, so we don't have final numbers for the year end. We gave you last month projected. We have some more payables that have been booked and a few other adjustments that still need to be made, but we're working on that. So hopefully that'll be done within the next month. What you have before you today is the first month of the current fiscal year. This is for the month of July of 2024. On page 15 is where we begin. So what we have here, your current assets are between your cash and your receivables are at about $6 million, and your liabilities are at $5,347,000. So you have a net working capital of about $600,000. Jump down to the bottom line on about the third line up from the bottom. You can see your annual or your increase or decrease for the current month. The increase was at $204,000, $203,835. Now, want you to be reminded that this month includes a grant that was received for $45,000, so that's included in that number. So back that out, you're at about $160,000 of income. Remember that we have the PPS settlement that's about $125,000 a month. That's based on the estimate that we've been given. So if you say we had 160 and our PPS settlement, which we book quarterly, is about 125,000 a month, then our actual net profit for the month was, what is that, $35,000. Okay? If you jump to page 16, you can see the revenues. That's where the increase, $204,000. Eden Valley had a profit of $228,000. The clinic, $75,000, and then district-wide expenditures, which get allocated, which we'll talk about in a little bit, is $99,000 of expenses to bring us to a total of $204,000. The next page, page 17, is an outline of where your cash. We have $2.2 million sitting at First Capital, $500,000 of that. Actually, it's a little more than that, is sitting in some CDs now that are earning some good interest. But that money is sitting there waiting to pay the PPS settlement. So the PPS settlement that's due like in September is 1.3 million, I believe. So that's going to eat away at that cash balance pretty quick. Okay, but the Mechanics Bank, that's our normal operating funds, and that's 1.2 million. Okay, here you can see at the middle of the page, the summary of income by month. You can see the $159,000, that's that $160,000 that I was showing. We booked the estimated PPS on a quarterly basis, so that's, you take the 125 away from that, that's your profit for the month. Okay? Page 18 is a breakdown of Eden Valley. And it compares it to July of the prior year. So it was a good month for Eden Valley. We had, I think the census was 49, 48. I can't remember. It's one of those two for the month of July. And so your net income was $227,824 for Eden Valley, compared to $85,000 the year before. So Eden Valley continues to do really well based on the census that we have. The bottom section is just by types. You can see that professional fees are down this year in comparison to last year, which is a positive sign. Just if you look up above in the nursing administration, that's where the big drop. In July of the prior year, we had, you know, some extensive nursing expenses. Okay. Page 19 is the clinic. Revenues for the clinic were down this July in comparison to the prior July. Contractual adjustments are up. Netting those together is not a positive. So we were 147,000 net revenues down for the clinic this July in comparison to the prior July. But our expenses were controlled, and so our expenses were down by 52,000, so our net decrease for the month of July compared to the prior July was a decrease of $95,000. Then at the bottom of the page, you can see, the income from each of the different entities and the depreciation to get to the 203,000. Okay? And then page 20 is just your summary of your cash flows, where you received cash, where you expended cash. So that is the treasurer's report, and then we can go on to, once you've acted on that, we can move on to the budget report.
Any questions on the treasurer's report? If not, we'll entertain a motion to accept the treasurer's report.
I'll make the motion.
Okay, Ann makes a motion, do I have a second?
I'll second it.
Rosemary second, roll call.
Graig,
Yes.
Rosemary,
Yes.
Ann,
Yes.
Matt.
Yes.
Okay. Budget review.
Okay, starting on page 21, we compare our actual results to our budget. So you can see the annual budget year-to-date. So this is our budget. This is 1/12 of our annual budget. And we expected to earn $11,735 for each month. Our actual for July, we had the 204,000 comparison to 11,000. So we were we're better than what we had anticipated, but once again, that includes 45,000 for a grant, which will have the expenditures down the road, and it also does not include the PPS settlement. So there are some mitigating factors there. It really is, if you take those items out of there, it's really about a $30,000 gain compared to a budget of 11,000. So we were like 19,000 over budget, which is still a positive thing.
What was the grant for?
CCAH.
There we go.
Food Access Security Grant. CCAH.
Oh, Central Coast Alliance?
Mm-hmm.
Okay.
Food Access Security Grant.
So this is your budget for all three entities. So if you look at the middle column, it's Eden Valley. If you look at the fourth column over, it's the clinic. And then the fifth column is your district. And then for the next 3 pages, we look at each of those entities individually. So you look at Eden Valley. The net surplus for 1 month should have been 77,000. We're at 141,000. Once again, that was because Eden Valley had a really good month for the month of July. As far as budget variances, the employee benefits are a little bit high in comparison to the year before. And what that primarily is the increase in health insurance. There was a catch-up in there as well, and so there was some adjustments there. We should see that going down over the next few months. July was a big month in expense for our employee benefits. And then our professional fees, there were also some one-time professional fees in the month of July that we should see that even out over the next few months as well. Okay? The clinic, we budgeted 511,000 total revenues. We got 517. Our expenses are down by about 123,000. Primarily in professional fees as well as supplies. But other than that, everything seems to be pretty much in line with our budget.
Well, we're pretty close on that numbers.
So far, it's only 1 month, so. Okay, and then the district,
Now, you know what, it's just a question.
going back to the clinic, sure.
Employee benefits were down at the clinic, but up at Eden Valley.
It could be because of the number of employees and the health insurance per the employees.
Oh,
Yeah. type of employee, how many are fully covered, how many have just, that have family coverage versus dependent coverage. I mean, there's a lot of different factors.
Temporary employees that don't get benefits.
Right. Okay. I mean, we can do an analysis, but unless you ask me, I'm not gonna do it.
That was sufficient.
Okay. And then on page 24 is the last page. This is your district. I can't remember why the professional fees were a little bit higher for this month. I'll look into that but that's the only area where there's some discrepancy, and I'll take a look at that. I can't remember, but I will come prepared next month. If I don't see a reversal of that in the month of August, I'll give an explanation as to why.
Those aren't attorney fees, are they?
Attorney fees would be included in there. Other fees would be accounting fees, but I know my fees weren't included in there. So, yeah, I don't know. I did not look at that before I came. I looked at it when I did it, but I don't remember right now. Okay, but in total, we're right in line. $12,000 difference, better off than what we budgeted, so we're doing well.
Well, that $12,000 is the difference in professional fees.
Yep. Yep.
Okay, any questions on the budget review? Max, any questions? Rosemary? I don't see an action item. Right, thank you very much.
Thank you, Brian.
Okay.
Thank you.
Item number 11, proposal to change the September 26th meeting time to 3 o'clock.
And that just will allow for participation in the CEO nomination and participation of myself in the board meeting. So that would allow for us to have our meeting and also participate in the CEO nomination, which is the same day.
And what will you be in two places at once if it's Sacramento?
Zoom.
Oh, you're not gonna go to Sacramento?
No, I will,
Oh,
but I'll be here on the Zoom.
oh, you'll be on Zoom
Yeah.
and we'll be here.
Or we just might
Gotcha.
move the meeting to the week before instead of short meeting.
Because I just,
Yeah, what's your druthers? What do you want? What are your wishes now?
Well, I'm used to it being on the last Thursday, so that's fine with me.
Okay, Ann?
I don't have any problems with it on Thursday.
Some of us should go to the ACHD meetings.
Oh.
I would attend.
Go to what?
This meeting where she's
She
going to
wants
be
to
at.
go to the Sacramento meeting.
Oh,
A lot of stuff happens there that we should know. That's what the meetings are about. I don't think we ever seem to go.
We've done in the past.
Okay.
Yeah.
I've never gone.
I understand it, no, that's one, yeah, and you're right. Okay, so, if you want to make a motion to move the meeting time to 3 o'clock on September 26th?
I move, our next month's meeting will be on the last Thursday of the month at 3 o'clock.
Okay, do I have a second? Ann, okay, roll call?
Graig?
Yes.
Rosemary?
Yes.
Ann?
Yes.
Max?
Yes.
Okay. District CEO's report, Eden Valley?
all right, good afternoon, everyone. I hope everyone is enjoying their summer. I welcome the folks that are here visiting us today from the union. It's been a great time at the district with lots of birthday celebrations. We had a rodeo week, district professional leadership development training, and employee summer barbecue, as Adriana alluded to in the July. I want to thank Rosemary, Graig, and Max for attending our summer barbecue, and thank Graig for agreeing to barbecue for all of our staff. Our staff really enjoyed it. I also want to acknowledge that Rosemary Guidotti had a birthday July 31st. Happy birthday. And Ann Trebino will have her birthday next month, September 21st. So happy early birthday to you. Therapy mixer, you guys have already shared a little bit with Adriana. It was a success, and I want to thank Rosemary and Ann for attending. We had representatives from Me Memorial, Salinas Valley Health Natividad, VNA, Central Coast Alliance for Health, Independence Medical Transportation, Sutter Health, board members, foundation members, Home Connect, community members that attended. As you recall, effective July 1st, we were fully equipped with advanced therapeutic team, experienced in working with trauma recovery and mobility patients.
We were poised at becoming the leading destination for those seeking specialized recovery and rehabilitation services in our district and beyond. We plan to have, and we had our meet and greet in July, so we're very fortunate to have this specialized team. On your tables, there is a copy of our soda shop grand opening, September 5th from 12 to 1:30. Hopefully you guys can join us and participate in that. As you guys recall, this was closed due to COVID, and we have since been able to reopen that and reestablish that, and hopefully you can come and celebrate that as well. It is a meeting point for residents and family, for staff during their lunchtime, and it's a good place just to have a good milkshake from Rosario. Soledad Unified School District, we partnered with the Soledad Rotary Club, where we welcome a back to lunch for all the staff and the teachers in August. That was a wonderful event as well. More things to come. Family Resource Center, so we partnered with Grocery Outlet to raise nearly $10,000 for the Family Resource Center. If you guys remember, Soledad Unified School District established their old library and created a Family Resource Center. So these monies will go towards feeding our community. They'll have food, they'll have clothes. They'll use all these dollars for that to give back to the Family Resource Center. There will be a presentation tomorrow from 5:30 to 7:30. Will be a check presentation. And Greg, as our president, is planning on attending that tomorrow. Project Food Box. So those of you should have a little flyer. I see that there. It looks like this. Project Food Box is another partnership that we have formed with the Soledad Medical Clinic. Project Food Box is driven by the belief that quality, nutritious food can radically transform the healthcare landscape forever. They deliver free, customized, medically tailored fresh fruits and vegetable boxes directly to Medi-Cal member doorsteps. They aim at addressing nutritional gaps that significantly impact the health and well-being of the vulnerable population that we serve. By participating in the program, our district's patients will receive a curated 15 to 18 pound grocery box designed by a registered dietitian to address the chronic health care conditions. Fresh fruits and vegetables from local farms are delivered for free directly to Medi-Cal members' doorsteps every week for 24 weeks. Have a better health outcomes. Research shows that access to nutrition meals can lead to better health outcomes and enhanced quality of life. So this is a new partnership that we have formed, and I've given you guys a flyer. Refer a friend. There's a QR code. It's in English and in Spanish as well. Leadership Academy. So our Leadership Academy 8th session and our final session of Professional Development Leadership Academy, focusing on coaching for employee potential. This was offered to 12 key managers at the clinic, Eden Valley, and Women's Health Center. It was a 2-hour training session, occurred once a month for 8 months. We presented certificates and celebrated the completion of the training with a cake for all those participants. In September, we'll begin our next 8-session series focusing on customer service developing training. The module will include empathy and compassion, effective communication, managing conflict, patient privacy and confidentiality, problem-solving skills, culture sensitivity, teamwork and collaboration, and technical skills. This will begin in September. You guys have seen, Adriana shared, there was some newspaper articles on our new therapy mixer and our new team. Hopefully you guys got to see that in our local paper. We continue to make capital improvements. Capital upgrades include our computers. As you guys know, there were many that were very outdated, 5 to 10 years. So we put a plan in place where we're replacing 5 each quarter to minimize the burden of cost and overwhelming the staff with upgrades due to the implementation. We finished the work for the asphalt in the delivery area of the kitchen. If those who have driven back there, you can see the difference.
It's very nice, yeah.
What else? let's see, so our new hires, our years of service, Viviana Santos, CNA, we want to recognize her for 1 year of service. Monique Peralta, activities, for 1 year of service. Sophie, can you ask? I'll let Susan finalize the rest of the report. I'll go on to the clinic. On the clinic side, we just recognized Dr. Giron. We actually recognized him in person for his 20-year anniversary. Haley Fletcher Billing, also 1 year of service, and Sandra Paredes, MA, 5 years of service. On September 29th, we recognized and did a grand finale Match Monday video for Grocery Outlet. As I mentioned earlier, we were able to help them match and raise over $10,000 for the Family Resource Center. I participated in the Center for Nonprofit Excellence Advisory Committee meeting with the Community Foundation for other nonprofit leaders looking to expand and grow knowledge in nonprofits. I talked about the Project Food Box and that we met with those groups, visited the Soledad Historical Society and supported them. We did the therapy Rotary lunch and the therapy mixer for this month. And I will have Susan come in just a second and we can talk about Eden Valley's update on census. I can give you just a quick summary. Census is currently 47, of which 10 are Medicare, 7 are managed, 8 are private, 29 Medi-Cal with no bed holds, and 1 hospice.
8 private?
I'm sorry, did I say that?
Yeah.
2 private.
Oh, okay. I thought 8 was.
2 private, and then we have currently a total occupancy of 83% based on our availability of beds currently in the center. And we'll wait for Susan so we can finalize.
Question in regards to the
Yeah.
clinic.
Great.
How are we doing with the training? You're doing your leadership training with the clinic, with the staff over there? What's the update on that?
We do monthly training just depending on the group. So we separate it into groups of MAs. We have one for providers. We have one at all staff. Everything goes well. Those are opportunities. In addition to that, managers have one-on-ones and leaders have one-on-ones to meet with their staff and kind of gauge what is going on for them and how they can support them in their roles.
I remember we were discussing the front end about that's the first impression of the clinic. Are we working with that?
We are. So we've done an expansion of our communications tool. So we've partnered further with Athena. Athena allows for patients who are part of our the app. They've signed up for the app. When there is, for example, a doctor who calls in sick for the day and we have to cancel other appointments, they will receive a call or a text message informing them that the provider is not available. They then can then call that number, which in turn will give them a live person that Athena has helped us do. So we have to continue growing that population, but those that are enrolled get that benefit to do that.
How are the volunteers doing at the front entrance? At your reception?
We don't have volunteers.
We have Isalia, but
I've heard that there's some volunteers working at the front desk, which is
Oh,
causing some fun with getting people in and getting
so
room.
we have
Front desk here at Eden Valley or
the front
At
desk.
the clinic.
The clinic. So we have students that come through and they train to shadow. So what we're trying to do is develop our next generation. So for example, today, if you walk the hallways today, we had the Hartnell College students here today. We didn't have an intern match, maybe that's what you're referring to. There was an intern who later applied and is now an employee of the front office.
we have volunteers here at Eden Valley?
yeah, we have a couple student volunteers. We had one throughout the summer, but now that school started, she committed to coming whenever she can on the weekends.
college students or?
She is an up-and-coming nurse practitioner. She's currently in high school.
So the other training question is code training here at Eden Valley after that big incident. Is that ongoing now? We finally got that implemented?
I'm sorry, what are you speaking to?
Code blue training on a regular basis and drills since that $25,000 fine we had because we didn't handle that well.
Code training?
Yes.
Code blue? Yes, we do it on a regular basis.
And just to clarify, that whole incident was based on a decision that was made at the time of the person. Is that the one you're speaking about?
With the decision that we got fined for, with the decision of who?
Of the person who was in charge, the nurse at the moment at that time.
That still means we need to make sure the employees are trained on those incidents so that doesn't happen in the future.
Of course.
We have $25,000 plus somebody passed, that's both pretty serious though.
Of course. And so that is an ongoing thing that we do.
Okay, good evening everyone. I am Susan Fan, the administrator at Eden Valley. This is my report for the month of July. Our census and occupancy, the average daily census is 48.45. Our average is about 49. And year to date, we are very close to staying that way at 49. Our occupancy percentage is 83%. Our average month to month has been stable and at baseline of 83%. And even year to date, we are at 83%. So we're kind of like at baseline right now. For the month of July admissions, we had 14. Our average month to month has been about 15 admissions. And year to date, we have a total of 116 admissions. For discharges in July, we had 21. Our average discharges was about 16. And year to date, we had about 119 discharges. For our skills mix, we had 10 Medicare, 31 Medi-Cal, 4.9 HMOs, and 1 private pay. We've been kind of staying steady, very fortunately for our community, to be around that with an average of 11 Medicares, 32 Medi-Cals, 4 HMOs, and 1.38 in private pay. For a lot of our referral sources, we get them from Salinas Hospital with 12, and then Natividad, we had 2 for the month of July. We have 1 person on our wait list. And then the next category, which is our CDPH and regulatory affairs. In July, we did have a COVID outbreak, and very fortunately, every one of our residents were safe and well. That case is still open, but it is closed by the Department of Public Health. So once we got everyone cleared with the staff COVID, then we are good. Very fortunately, all of our cases that we have up to date have 0 deficiencies. And for the month of July, I'm glad to report there are no incidents. For operations, up to date right now, we have 100% compliancy with our PPD, which basically tells us how much time our nurses are caring for our residents. So we are at 100% in regards to meeting the regulatory standards. Our rating right now is 2 stars. In health inspections, it's 3. Quality measures, we have 4. And our staffing, we have 1. For our committees, I'm glad to report that all of our QAPI meetings that we've had with all of our plan of corrections have been 100%. We're very close to closing all of our plan of corrections. For our safety committee, we have reported no injuries, and we have continued to do routine scheduled trainings for all of our staff in regards to their safety. For pharmacy report, we are 100% compliant with all of the regulatories for that committee. And then for our fall, we had 10 falls for the month of July. All of our interventions and programs have been in place, And we are continuing to look at other improvements to make sure our residents are safe. First is our fall rehab prevention program that I will be working with, and it's part of the CDC's program that they've implemented nationwide for residents who have falls. The next one we have currently in place is our Falling Star program. So when you walk down hallways, you'll see a logo there at the door of someone who may be a fall risk. And if someone did fall, they would have a falling star placed at their name at the door. We also do routine clinical assessments upon admission for residents who are at fall risk, so we can identify them immediately and put a fall prevention in place. And lastly, we work with our pharmacy to make sure that there may be medications that may be adjusted to ensure their safety and well-being, and also reduce their falls in that capacity. And lastly, under other, we did have a wonderful celebration of life for our long-term resident here, Mr. Francis Rubo, in our garden. So that is my report for Eden Valley.
Any questions?
I have a question. What does it mean staff only has 1 star? What on the staff is graded?
Well, under quality measures, there are a whole bunch of categories to meet, and one of them is to have RNs in place. LVNs do not count towards the per patient per day care. And so there's that component. Also, it's important to make sure that we retain and recruit as often as possible to make sure that we maintain the quality standards and per patient per day, which is 3.2 here in California. And then lastly, a lot of that has to do with quality care that our RNs do, as well as our CNAs. So as long as we meet all of those categories, among other, bullet points that they give us, we have to meet all of those. But it can change very quickly as long as we can determine if it's in our best interest to hire and recruit RNs, because your star will immediately go up just with RNs in place.
Which you did this month.
Yes, very fortunately we have. So I'm very confident within a couple of months, because they do these reports quarterly. So you can see your stars go up or go down very quickly. And then the health inspection one is the annual surveys that we do. That one, they keep on record for 3 years.
I have a comment. That was a very thorough report. Thank you. And I think it should be noted that you and your team, if I heard you correctly, it said there was no incidences in July and 100% compliance.
Absolutely.
So that speaks very highly of the staff here at Eden Valley. And I, with Rosemary, was concerned when you said the star rating of 1 on staffing. And, we can only improve on that if it's a 1. I don't think they give 0.
Yeah, they don't get zeros.
So we can only improve on that, but I think that should be noted that with no incidences and 100% compliance, that speaks very highly of your staff.
Oh, yes, definitely, and I do, it's not me, it's all the team that's putting the documentation, doing the right training, and having everything in place and following the protocols that we have available for them. So definitely,
And so you hired a new RN?
We did.
And that's the head nurse?
They're RN, so they're support on the floor.
On the floor.
Yeah.
On your numbers, you were breaking down Medicare, Medi-Cal, private and HMO, but you don't list HMO in here. Does that mean the private, some of that's HMO and some of it's private insurance, or?
HMO is broken down. It's 4.9.
Not on this.
On which one?
Not on the list.
Oh, I didn't see that one right there. I have this report.
Okay.
Is that under PCC?
It's our
that
monthly
you know,
census. We get this every month.
We provide it.
Okay.
And you're breaking it down and wondering what the breakdown is and how that affects our
Yeah.
knowledge.
Well, there's long-term and there's short-term. So I'm not including the long-term HMOs like Medi-Cals or someone else in there. So I can definitely correct that to make sure that you see it matches what you're getting from that report. But every day we do have an average about 30 combined HMOs.
Any more questions over?
Very, very thorough, thank you.
Thank you
That
very much.
concludes my report.
Okay, thank you. Have a good
Thank you,
evening.
Susan.
Okay, we're going to adjourn to go into closed session. Thank you all for coming. you. All right. Okay, going back into closed session.
Yeah, open session.
Open session, I'm sorry. What I mean, one second.
So I make a motion that we renew Ida's contract for the 4 years and with a bonus of $10,000 for this past year's work and a $10,000 salary increase.
I'll second that.
Wait a second. We're going to do a roll call vote.
Okay?
I'm going to vote yes.
She doesn't know yes.
I'm going to vote yes.
Taking notes.
Oh, I thought you asked her vote. Yes.
Yes.
No.
Okay.
Okay.
We're adjourned.
Okay.
Thank you, everyone. Have a good evening. Appreciate all of you.
Okay.